Hello, everyone. My name is Shanila Chapman, and I am a student at the University of New England pursuing a master's in applied nutrition. I am here today to present a systematic literature review on the effects of oral magnesium on fasting blood or plasma glucose and HbA1c or glycated hemoglobin in diabetics. So, here is a quick overview of what we are going to explore today. In the introduction, I will go over why it is important to explore the topic at hand, why diabetes is so complicating, and how it can cause high morbidity in our population. Next, we will examine the PCOT research question, the methodology, which will seek to explore how I came to find the articles and the exclusion criteria as well, followed by the discussion where we will have a close examination at all four articles, the visual abstract, and the conclusion. Then, next after that, we will examine all the strengths and limitations of the research we have gathered, the implications for research, and the implications of practice. Diabetes is the eighth most common cause of death in the American population. It is usually diagnosed around ages of 60 or 50, but lately it's climbed down and is affecting people in their 40s. Because of that alone, it is important that we act now. Our way of life and our quality of life is threatened as this disease seeks to take away our quality of life. Diabetes is known to cause damage to our blood vessels, and it also can cause or be a result of hyperglycemia. Hyperglycemia is a factor that can either worsen or also cause high blood pressure. High blood pressure can lead to heart disease and a plethora of other health issues, which is not good for the overall population. There are other options for combating diabetes. Although insulin and metformin, along with other diabetic complications, are seen primarily in patients in the US and around other areas in the world. In a world where people are losing their trust in pharmaceutical medicines, I believe it's time we introduce more holistic or alternative paths of medication where the user does not feel conflicted about the damages or risk that a pharmaceutical drug can take to possibly harm them or hurt them in any way. The PCOT question reads, among adults 35 to 65 years of age with type 2 diabetes, how does oral magnesium supplementation at a dosage from 250 to 350 milligrams when taken for at least 3 months affect fasting blood glucose or fasting plasma glucose and HbA1c levels? I was able to answer this question by examining 4 randomized controlled trials. 3 out of 4 of those randomized controlled trials were double-blind. Also, majority of those were at a minimum of 3 months, while there was one study that lasted as long as 6 months. A common factor in all 4 studies was the fact that, along with the main intervention group who received the magnesium, both control and intervention groups were prescribed a general healthy diet. When searching for these articles, Google was used along with the TRIP database and PubMed. The general search found over 12,000 articles, but through a very lengthy process, I was able to find 4 primary human articles that met all the criteria. One thing that was In common with all four articles were the Medline mesh words. I typed in magnesium along with administration and dosage, dietary supplements, since it falls within that category, blood glucose slash drug effects, and diabetes mellitus slash blood. And all articles used for this systematic literature review were through the time period 2014 to 2024. Thankfully, the inclusion criteria for the study was nothing that put our patients at an increased risk. They were allowed to resume their regular diabetic medication as normal and their insulin as well. Other medications that did not affect their magnesium absorption or that inhibited magnesium absorption were also allowed. Unfortunately, they were excluded from the study if they were taking immunosuppressants, if they had severe diseases such as cancer, or they're taking calcium, magnesium supplements, and have numerous diagnoses, which could get in their way because if they're taking more medicine that we don't require, it could severely affect their results and put them in harm's way, and we never want to put our patients at risk for anything. In the first research article by Talleri and others, he wanted to find out how magnesium at a dosage of 250 milligrams for 24 weeks or 6 months affected his diabetic hemodialysis patients. 54 patients were used, and there were 27 in each control and intervention group. Magnesium oxide was used in the pills, and the median age for the control group was 61 years old, while the intervention group's median age was 58 years old. All participants also had to utilize a 3-day food and activity diary, and they were called at least once every 3 weeks to check on their progress, how they were doing with their food, if they didn't change anything, and they were excluded if there were any major changes or if the participant was taking other supplements that affected their magnesium serum levels or other levels. Fortunately for the results of this study, HbA1c was found to be significantly reduced by the magnesium. But unfortunately, however, fasting blood glucose was not significantly reduced. It was still reduced, but not significant enough for research. And limitations in this experiment were few and far in between. The authors of this research article said that they wish they had a bigger sample size for more legitimacy, since about 5 to 8 people dropped out from their experiment. It dampened the results just a little bit, but in the future, there are talks about including more sample sizes and having longer durations spanning 1 year or more. In the second study, the population that was chosen were type 2 neuropathy diabetics. The mean age for both control and intervention groups were around 45 years of age, and it included Iranian men and women. A total of 80 people were used, and each group was split into 40. For the intervention and dosage, again, 250 milligrams of magnesium oxide was used, and the experiment only carried on for 12 weeks, or the equivalent of 3 months. Participants were also asked to fill out a 3 to 4 day journal for their physical and food. They were also instructed to consume a general healthy diet that is low on fat, salts, and sweets. Even though the results show that there was a reduction in both HbA1c and fasting blood glucose, the results were neither significant for either group. The p-value for the HbA1c only reflected 0.80, and the FBG, when compared to placebo, was 0.54. The reason for this, they believe, is due to the effects of the neuropathy. And they believe that a longer duration could see a more significant change in both the HbA1c and fasting blood glucose levels, and a better tool to measure the magnesium levels in each one, since there was not a clear indication for the serum magnesium measuring the intracellular magnesium within the blood and bones. Razagai and others in this third study examined diabetic foot ulcer patients. Now, the mean age for both groups, the control and intervention, were around 59 years old, and both groups primarily consisted of men. A total of 70 patients, split up to 35 for each group, participated. And just like the second study, this study was carried on for 12 weeks, consisting of 250 milligrams of magnesium. All patients were instructed to partake in a 3-day food and physical record, and they were contacted every the 3rd week, 6th week, 9th, and 12th week. For this study, the results were very favorable. As you can see, the fasting plasma glucose was significantly reduced, showing a significant p-value of 0.04. Now, this is under the significant factor of 0.05, as the HbA1c also showed significant reductions with a p-value of 0.03. Few limitations exist, as the authors stressed how they would like more time and more testing materials to examine the effects of magnesium on the fasting plasma glucose and HbA1c levels in terms of oxidative stress and systematic inflation, which are two factors that occur commonly in people with diabetes or people that have complications to follow. This next study by El-Darari and others examined a rather normal diabetic population. Now, in this population, nobody had diabetic foot ulcers, neuropathy, hemodialysis. These are normal type 2 diabetic patients. The mean age was around 51 years old, and each group had a healthy balance of men and women. This was also the only study that was completed in Palestine, as the others were completed in Iran. The intervention for this study included 250 milligrams of elemental Jameson tablets, and it concluded in 12 weeks. These particular people were also constructed to partake in a general healthy diet and were called at least once a week to check in with researchers alike. The results for this study were kind of split in the middle. So as you see, for HbA1c, there was a high level of significance, as the p-value when compared to the control group resulted in 0.001. Now, for the fasting blood glucose, it only resulted in a p-value of 0.068, which is not below the standard of significance 0.05. However, when it is not compared to the control group, the pre and post period of the fasting blood glucose, when taken in the 12-week span, resulted in a significant reduction of 0.009. Now, El-Darari and others did not really talk about any limitations within their study, although there is a lack of funding, which could account for a lack of duration between the periods. Studies of 12 months of longer could show potential lung benefits of magnesium supplementation. In this visual abstract, you will see a general summary of all 4 randomized control theories. In each article, patients ranged from 35 years old to 65 years old. 250 milligrams of magnesium was used in all 4 studies, and only 3 of the 4 were only prescribed a general healthy diet in the control groups. Only 1 study had a placebo pill that was basically made out of starch. And 3 out of 4 groups also met the minimum requirement of carrying out the study for 3 months, while 1 study was carried out for 6 months. If you go to the next line in the outcomes, the hemoglobin was reduced in 3 out of 4 studies when compared to the control group, and fasting blood glucose was reduced in all studies, regardless of complications, which is very promising. The conclusion statement reads, oral magnesium supplementation at a dosage of 250 to 350 milligrams positively affects fasting blood glucose and HbA1c in type 2 diabetics. And 3 of the 4 studies presented reductions in fasting blood glucose and HbA1c were recorded within 3 to 6 months of daily consumption in tandem with regular insulin and diabetes medication, such as metformin. And this conclusion statement has a strong grade. As you can see, the evidence supports reductions in each group, regardless of other complications that may occur and may affect absorption of the mineral. As we examine our findings and results some more, we can see that constant oral magnesium at a dosage of 250 milligrams can consistently reduce fasting blood glucose or fasting plasma glucose, regardless of complications, as it did in 4 out of 4 studies we looked at. It can also improve blood vessel functionality, which is very important, especially in a diabetic patient, since high blood pressure is a common comorbidity. Since fasting plasma glucose or fasting blood glucose is consistently reduced along with HbA1c in terms of certain complications, we can conclude that it improves insulin resistance. Unfortunately, there were a few limitations that stand in our way, as lack of funding can dampen some of the results we have, as majority of these studies were done within a 3-month period, which is relatively short. Studies 6 months or longer are few and far between. Also, in 3 out of 4 of the studies, the research was conducted in only 2 countries within the Middle East. So even though there was 2 countries, they were still within the same region. So the people that were on general healthy diets were generally all consuming the same type of foods. There was also lack of funding to affect the measurement tools used in measuring magnesium, since magnesium is a mineral that is not always accurately measured within the body, since it is found primarily in the bones. As we progress further as a civilization, the implications for research considering oral magnesium supplementation for type 2 diabetics shows that there is a promise for holistic or safer medication alternatives in partnership in type 2 diabetes treatment. As we see that oral magnesium when supplemented along with metformin or insulin or other diabetics medication, can reduce fasting blood glucose levels and HbA1c levels. There is an added interest in its effectiveness following extended durations. Studies that are completed in 12 months or longer can further strengthen the argument that oral magnesium can be an effective treatment for type 2 diabetics if they are dealing with uncontrollable hyperglycemia or any other complications that may head their way. In the field of medicine, it is better to have our options open, and it is better for us to seek different ways of helping the community, especially with a disease that is estimated to grow well over 700 million by 2045. In practice, magnesium at a dosage of at least 250 milligrams can be used for type 2 diabetics today. However, we would need to check out their complications, as diabetics with liver or kidney issues could present a problem as their absorption can be delayed, as we saw in other type 2 diabetics with other complications outside of the low to complicated groups. We also saw that magnesium oxide pills are effective tablets for added benefits and reducing fasting blood glucose and HbA1c in type 2 diabetics, which shows that they can also potentially be paired with other nutrients. Thank you all for your time. I'd like to thank my professor and my students. And here are the references and sources for all my material. Thank you so much for listening to me.